So hello, everyone. Thank you so much for joining us for the 2015 Advocacy webinar. My name is Ryan Fisher, and I am the Senior Vice President of Community Engagement. And this webinar is for those of you who are joining us in Washington in a few short days and praying for good weather. And it's also for the broader community of people advocating from home. The overall goal is just to help you all better understand our 2015 plans, our agenda, and what we really hope to accomplish. Just some housekeeping items. If you'd like to make a comment during the webinar, you'll notice a chat box in the lower left-hand corner. You're all on mute mode, but you can feel free to type in questions, and we will go over these questions at the end of the webinar. And if we don't have time to answer all of them, we'll contact you personally afterwards. I'm really very lucky to be joined today by PPMD's Senior Vice President of Legislation and Public Policy, Annie Kennedy, who joined PPMD this past fall, but really has been working with us in collaboration for over a decade in her former role at the MDA. I also have on the line Nick Minetto. Nick has been a consultant and a friend of the organization for well over a decade and is with Fagre BD Consulting, our partners in Washington. So here's a look at the agenda for the webinar. I'm going to go through some of our advocacy history, give you an idea of how our strategy has really evolved over time, talk about where we've come from as a community and where we hope to go, and then Nick will give us some highlights from last year's advocacy agenda, talk a bit about the appropriations process, and of course about the new incoming, or here, not incoming, new Congress, 114th. And then Annie will then go into what are we asking Congress to do in 2015, give you a bit more context around the actual ask for this year. And we'll finish with what you can expect if you're a home advocate or if you're DC bound, and finally some Q&A. Again, if you have questions, comments, anything you need clarification on, there's the chat box in the lower left-hand corner. I really like to start with this landscape slide because it really shows all of the pieces of PPMD's comprehensive approach to ending Duchenne. We've always invested in the 4 pillars: research, advocacy, care, and education. As you all know all too well, that Duchenne is not linear. You can't just fund a research or a single strategy and hope for the best outcome. You have to create a road to treatments, and that involves concentrating on a number of fronts. So we dedicate our efforts on ways to advance promising research, improve care standards, create a clinical landscape that can handle trials. We create tools to speed the development of therapies, and of course, we advocate on the federal level. And advocacy really has become such an important part of the work we do, and in turn the work our entire community does to change outcomes in Duchenne. We have seen advocacy be a very powerful weapon in this fight against Duchenne. So why do we advocate? Well, it really, truly makes a difference. Telling your stories has a tremendous impact on those who represent you in Congress. Creating relationships with members, creating champions for Duchenne. Congress takes your request and turns it into action in the form of federal funding and focus on Duchenne. And we have seen this over time. The proof really is in the pudding. We've seen major changes in the landscape because of advocacy and because of you creating long-lasting relationships and new relationships with members of Congress over the past decade and a half. And if we take a look back at our history, it really all began with the passage of the MD Care Act in 2001. It was in 2000 that we as an organization created a very focused advocacy strategy to make our case for parity and focus and funding in Duchenne. At the time, we also met a father by the name of Joel Wood, who is a lobbyist in Washington. Joel's son was diagnosed with Duchenne and decided to partner with us and along with the MDA try to change the way the federal government looked at Duchenne. Together we worked with Senator Roger Wicker, who is then Representative Wicker, to craft a piece of legislation, or as Roger Wicker said, run us up a bill at the time. And back then there was very little investment in Duchenne by the federal government. Overall, for the muscular dystrophies, there was only around $17 million spent annually. Much was missing back then. There was no care standards. Pharma was absent from the space. We had no outcome measures and natural history studies. We were missing so many pieces of the puzzle. And what the MD Care Act did, well, it was a game changer. It really, it started us off. It created the momentum we needed, brought out centers of excellence, a real federal investment in the space, began the process of creating care standards, and created a very important muscular dystrophy coordinating committee to link all the relevant agencies together and create an action plan for the muscular dystrophies. So it really was because of this bill that momentum started to gather. And the bill was reauthorized in 2008 and recently updated with amendments in the fall of 2014, which we'll get into a little more later. So this was a pivotal moment for our community and has ushered in a new era for Duchenne. Here you could see a timeline of PPMD contributions really coinciding with the timeline of the legislation. It has taken a true public-private partnership from multiple stakeholders to move these programs along, and we've seen tremendous results over the past 14 years because of the advocacy involved. Over the last decade and a half, we've had well over $500 million spent by the federal government in muscular dystrophies, and nearly half of that has been in Duchenne. So it's been one heck of a fundraiser and really has brought the community together to make a meaningful change. And what this has done is it's led us to a pipeline full of hope and promise. We talk about this a lot. While it's very exciting, there's still a lot of work to be done. The inclusion criteria for trials is quite narrow. And it's never fast enough. And we also realize that it's going to take a combination approach to really make the change that we need to see in outcomes. So it's exciting, though, to have so many companies in the space. And I think we should be glad about the progress to date, but realize that there's so much work to be done, and we can't really lose that momentum that we've started. So because of this exciting pipeline, here's a look at some of the Duchenne trials that are coming soon. And I think both of these slides, which we'll have on hand at the Advocacy Conference, are great visuals for Congress because they want to see meaningful impact. And these are proof that their early investment 15 years ago has really yielded tremendous results. But it was because of this that we knew we needed to have a much more organized and strategic regulatory strategy. So, as we've seen these therapies move through the pipeline, obviously the end goal is approvals, and the FDA is really on that. The end result of that is really working with the FDA and ensuring that they understand Duchenne, and see and figure out ways that we can help educate them about the disease so they can make decisions on applications for therapies. So we have been in discussion with the FDA for some time now, and in 2012, we're always looking for opportunities, and in 2012, we saw an opportunity with a bill called the Food and Drug Safety and Innovation Act. This is an FDA-related bill. And we worked with other rare disease stakeholders to advance specific provisions that could impact positively rare disease, specifically Duchenne. And the end result was a mandate for more patient engagement and an initiative out of the FDA called patient-focused drug development. That's really a buzzword right now on the Hill. And I think many people are trying to figure out what it means and the implications of it. But, of course, the Duchenne community has really throwing it on its head and taking it a step further. We didn't wait. We said, oh, you want patients involved? All right, we'll get patients involved. And we came up with some innovative ways to engage the community. So with the new law, to kind of frame this, we came out with a white paper called Putting Patients First. We wanted to really lay out how Duchenne fits into these new provisions within the FDASIA FDA-related bill. And this includes policy recommendations that would set the stage for ongoing conversations with the FDA. And those recommendations included expanding the use of accelerated approval for Duchenne and other rare diseases, issuing clear guidance on surrogate endpoints, piloting the use of adaptive approvals, which we feel is a tool they have on their shelf that they don't use, and then, of course, give greater weight to demonstrated benefit-risk preferences. And speaking of benefit-risk preferences, PPMD undertook a specific benefit-risk study initiative to better translate the patient voice into usable data for the FDA. In our interactions with the FDA, we would tell them that our population was willing to take greater risks and that just living with Duchenne was a risk. And they said, well, that's all well and good, but we have no data to back that up. So PPMD's own Holly PA, and in partnership with John Bridges out of Hopkins University, created a pilot study on benefit risk. And the results were quite clear that caregivers prioritized the protection of muscle function over all attributes, including longer lifespan, which was a significant result of the study. So it really is taking those statements from the community and anecdotal stories from patients and caregivers and making them into data that the agency could understand and hopefully utilize in the review process. Keep in mind, this was only a pilot study, and the FDA was quite favorable about this initiative, but they want to see it expanded into adults and as well into families that are harder to reach in the community. So we are in process and looking to do so. And for those of you who are going to be joining us in Washington, there will be more about our benefit risk efforts on Monday during our regulatory update. So as I mentioned before, we have been engaging with the FDA for some time now, educating them about Duchenne, the unmet medical need, and the need for flexibility in review. So in 2013, the EMA created a guidance on Duchenne. Now, the EMA is the European version of the FDA. So when this happened, we were encouraged. It's pretty historic that this was happening. And the guidance is basically the current thinking on a topic. And it helps industry and helps regulators better understand the disease, things like clinical trial design, benefit risk, outcome measures, and endpoints. So it gives kind of a roadmap for stakeholders, reviewers, industry, and the like. So we were excited about this effort by the EMA, but the first iteration really didn't take into account the patient voice. So representatives from the global patient community, which included PPMD and UPPMD, our sister organization, met with the EMA to discuss the much-needed changes in the document, and that process is actually still ongoing. Meanwhile, back in the United States, while we were meeting with the FDA later that year, we discussed the efforts by the EMA and their guidance, and we requested that the FDA do a guidance of their own to basically harmonize efforts. And they said no. They said we have 8,000 diseases. There's no way we would be able to do one by one. And so they actually suggested perhaps the Duchenne community could submit their own guidance to us for consideration. And without really thinking about it, we said, sure, we gladly take on that challenge. So we wanted to start the process in a thoughtful way. And with that, we we planned the Duchenne Policy Forum in December of 2013 to really lay the groundwork for creating a guidance on Duchenne. It was an amazing meeting. Members of the Duchenne community, to include 20 Duchenne foundations from around the world represented, and another 100 unaffiliated patients and families, along with 19 members of the FDA, met and began the discussion of what this guidance would entail. And we went through discussions ranging from benefit, risk, natural history, outcome measures, and the like. So this started the process. We created we created a whole structure for the guidance, and from that day forward, PPMD led the effort to draft a guidance on Duchenne. We had a steering committee, working groups, and a community advisory board, and this was well over 80 stakeholders, experts in Duchenne, as well as patient and family representation. And the community advisory board oversaw the entire process and were able to comment while the document was being drafted. And that community advisory board had 23 representatives of Duchenne foundations and then another 25 unaffiliated parents and patients. So with the submission of the guidance, which was submitted this past June after a 6-month process, which was very exciting, although it happened the day before our annual conference, so you could imagine we were all pulling our hair out. But we did it, and it was a proud moment for our community. And we included a community imperatives cover letter to the FDA, which really did reflect the patient voice. And some of those highlights from that community imperatives letter included that trials should be inclusive of people with Duchenne of all ages. Right now, as you all know, the inclusion is quite tight and narrow, and really an emphasis to move away from placebo controls and use other trial designs. And we wanted the FDA to really consider benefit-risk preferences of the community and encourage maximum flexibility in review. So it was a very big moment for our community. The FDA is expected to write their own draft guidance on Duchenne. We saw it in a presentation for their priorities for 2015, which is very exciting, that the Duchenne community is listed under their priorities. It means that they are hearing us, and we're hoping that we see positive steps in that direction in the coming months. They had a full meeting this past summer to discuss our guidance, and we're going to keep on them and make sure that we see something this year. So that just gives you some background on both our regulatory strategy and really what's been happening with advocacy over the last decade and a half, an abridged version of it, of course. But I want to turn it over to Nick Minetto, who's going to go through the appropriations process. And that has been such an important part of our overall strategy and has really helped us make the gains that we're seeing today. And then he's going to go through a recap of what happened in 2014 and then talk about the new 114th Congress. Nick?
Thanks, Ryan. Great to be here today and look forward to seeing all of you on Sunday and next week. And thanks, Ryan, for giving me the fun job of talking about the simple, complex, and smooth sailing congressional budget and appropriations process. But as you noted, it is a very important piece of our longstanding advocacy agenda. So I'll talk a few minutes about sort of what it is, what it isn't, and then we'll look at what we've been able to do in the past couple of years in the climate here in Washington. So the budget process, there we go. So this little slide shows how the budget process works, or at least how it is supposed to work. It really actually began in earnest earlier this month when the president submitted his budget blueprint to Congress. Usually that happens, or it's supposed to happen, in the early part of February. We've often had this delayed by weeks, sometimes months, because of other challenges when things just don't work right. But essentially the budget comes down to Congress, and then Congress is supposed to develop their sort of response or their own budget blueprint. And then that document then is important in that it shapes or sets the parameters for the appropriations process. So, while we might all think of budgets in our sort of household or business senses sort of being where you get specific, how much money you're going to put down for food, how much you're going to spend on gas, how much you're going to save, all that. The budget process, at least for Congress, is more of a higher level framework. And then the real work that especially is important to us comes when these committees, the appropriations committees in the House and Senate, and then they have various subcommittees, get together and they work on developing the specifics of exactly how the federal government will spend its dollars and what policies they will prioritize or not prioritize during the next fiscal year. So that's really where we tend to focus on this component of the agenda in terms of trying to get specific provisions in that influence how they spend resources on research, on public health, on care, on the FDA process and the like. If this works as it's supposed to work, you have the Congress work on these appropriations bills during the sort of late spring and summer time frame, and then come early fall, early October, everything would be signed and ready to go with a new budget in place for the next fiscal year. But the reality, of course, is that we haven't seen this work this way in more than a decade. You often have situations where the House and Senate might not even do a formal budget or reach agreement on a budget resolution. This causes problems for the appropriators who might be playing with different sort of top-level numbers or caps. The appropriations committees tend to do some of the bills, work on some of the bills, maybe pass some of the bills, maybe some even get through the full House or Senate, but they tend to not get all of them done. And we have had a situation where very few of these single bills are enacted into law, and we have had a situation where none of them have been enacted in recent years before the start of the new fiscal year. So, of course, that requires Congress to do a temporary package or a continuing resolution to fund the government to avoid a shutdown. And I'm sure we're all remembering the last shutdown that occurred in the fall of 2013. And you'll often hear, specters or threats of shutdowns in the, popular media. But, hopefully we tend to avoid those when cooler heads prevail. And then what often happens is that a final massive package of these bills is finalized in usually late in the year or right before Christmas. So you'll hear us talk a good bit about, appropriations, programmatic language, and report language. So report language, just to give you a high-level view of what this is and isn't, it's essentially guidance that the committee says we're going to include in our bill to derive an action by the federal agencies that are funded under these bills. They could be sort of instructions on amount of money that should be allocated to specific projects, directives. Sometimes they ask for a report or ask for an update, particularly if the committee is concerned about a lack of progress or lack of timely progress on a priority. Or sometimes they'll even use restrictions included in the statutory language that will prohibit the use of federal funding for specific purposes. This is usually a pretty strong action that doesn't happen that often, and you'll probably hear a lot of talk about this if you hear and listen to the news around, the Affordable Care Act, and sometimes, there are pushes ongoing around, limiting the funds that the IRS can use to enforce pieces of the, ACA, Affordable Care Act, or Obamacare. But the bottom line is, this is a tool, one of the tools in our toolbox that we have used successfully over the years to help advance PPMD's legislative priorities and shape the activity in our space that occurs at a number of federal agencies like NIH, CDC, FDA, and the like. So, quick recap of 2014. This was actually a very strong year for PPMD and for the Duchenne community overall and the muscular dystrophy community overall, where we were able to, thanks to the hard work of our advocates, secure the enactment of the Muscular Dystrophy's CARE Act amendments into law back in this happened in late September. but it took essentially the 2-year window of the 114th Congress to get this done. Building co-sponsors, getting it through the House, getting it through the Senate, negotiating lots of conversations with offices around, what needs to be amended, what can stay, what has to go. And ultimately, we got to a point where we were all satisfied and got this bill enacted into law. And this, I think, as all of you know who have participated in past advocacy conferences, really seeks to update the 2001 law and the 2008 amendments to make sure it's keeping pace with the needs of today. We also secured $6 million to sustain the muscular dystrophy program that the Centers for Disease Control operates. And this is an important program for a number of reasons, but particularly because this is a source of funding for the care standards. And I think most of you know how important these standards have been to enhancing life and increasing the lifespan. And there's a need to update them and to fill gaps in the care standards, so this money will be helping to do that. And we also secured the first ever provision on Duchenne in the FDA appropriation spending bill, really trying to nudge forward some of the activities that Ryan briefed you on. This is a bill where you don't typically see language on specific conditions, so this is a good milestone and something we want to build upon this year and going forward. Now, I mentioned that the MD CARE Act was enacted last Congress, and that was a good thing because the beginning of this year brought with it a new Congress, the 114th Congress. And if we had not achieved enactment of the MD CARE Act, we would have had to have started basically all over again with reintroducing the bill, building co-sponsors, and going through that whole process, because once a Congress ends, all legislation that has not been enacted dies. So we are very fortunate and happy that we got the MD CARE Act done during a 2-year period, so it doesn't have to remain on our advocacy agenda, at least in terms of the legislating component of it, doesn't have to remain on our agenda today. Of course, we had elections in November. The elections resulted in new Republican majorities in both chambers, the House and Senate. So that's a new development. Last year, of course, we had divided Congress, where you had the Republicans in the House, Democrats running the Senate. But as many of you know, this actually has, in the Senate, you still need to have quite a bit of bipartisan support, just given the rules of the Senate and the nature of the beast. 60 votes are critical for many issues to proceed, so it doesn't negate the need to continue to be very bipartisan in our approach. We also have seen a lot of new faces. This is sort of continuing with a trend we have seen in recent years, really going to the middle of the last decade, kind of from 2008 onward. We've had a lot of turnover in Congress driven by retirements, and then also in some of these wave elections, some defeats of longstanding members. So we have, almost 60 new freshman House members this year. So, 13% of the House is new. And a good chunk is, relatively new in that they're under, in their first to third term. So we have generally still to speak a lot of relatively new blood in the Congress. And we also have 13 freshman senators, some of whom came from the House, but others who came from state government, state legislative services, business, and the like, who don't come with, really any congressional or federal legislative background. So I'd be lying to you if I told you that everything is just hunky-dory over here and the folks are skipping through the fields, arm in arm with forest creatures singing, zippity-doo-dah, and everyone's getting along fabulously. It's a bit of a challenge right now where we have a continued divided government, higher levels of partisanship.
I know, insert laugh track, that was funny.
I think we all mentally pictured it.
Harry Reid and Mitch McConnell skipping through the chamber.
Right.
We have our high levels of partisanship. We have continued fiscal challenges. This is probably something, we'll prepare you guys to hear a lot of during your meetings about spending reductions and cuts and tight budgets and caps, and really what that means for issues like ours. And then you've got, of course, a lot of air expended on some of these big ticket items. And I say dealing with loosely because a lot of times, this is all a lot of theater and they end up voting and then it gets vetoed or it's a veto threat and not much actually moves forward. But a lot of the energy is expended on topics like still the Affordable Care Act, the energy issues with the Keystone Pipeline, the, foreign policy crises du jour, continued economic recovery and the like. And then, of course, all this is playing out while each passing day seemingly brings more attention sort of shifting to 2016 and the presidential election. So you have a very limited window of time this Congress for them to really accomplish much before truly by, the end of this year, early next year, almost all the attention will be focused on 2016. But I do want to leave, while it's not, zippity-doo-dah and, skipping through the halls of Congress, we do want to make sure everyone understands that stuff, despite this sort of climate, does get done. And the MD CARE Act amendments are a clear example of that. When you have a strategy, when you have a focus, when you have a solid issue, when you build your base of support, and when you do everything right, you can still get stuff done despite the sort of do-nothing labels that have been attached to recent Congresses and laments of legislative activity. It's definitely a lot harder than it's been, and it was, 15 years ago or 10, 15 years ago, but it still gets done, and, we want to approach our advocacy agenda and our conference with that spirit. Can do, let's continue to build upon our foundation and, advance our agenda. It'll be a challenging year, but we have an agenda that really builds upon the MD CARE Act. Much of what you'll be talking about on the appropriations report side is really trying to implement the law and building upon a lot of the patient engagement and related reforms that have been happening over at the FDA and that Congress has been very supportive of. So we're not coming in with unreasonable, pie-in-the-sky requests, and that'll give us, again, a good prospect for success. So with that, I think I turn it back over to Ryan or over to Annie this time for the advocacy agenda.
Great. Thank you. So, speaking to the climate in Washington, so I do want to mention, so with the 58 freshman members, I think that what's really important to mention about that, so Nick and Ryan and I spend a lot of time on the Hill and go to a lot of Hill meetings, and rarely do we attend a meeting where somebody doesn't talk about a meeting they've had with a family. So if you guys have come to the Hill as a part of either the Advocacy Conference or you've been here on spring break and gone to the Hill or reached out through grassroots outreach and met with members or their staff, literally they will stop the meeting and tell us and reflect on the meeting that they've had with the families. And nothing that we can say in that meeting can ever take the place or top the impact that meeting with a family and the stories that you share and translating what I'm getting ready to talk about into what that actually means to you and your family and your experience is so much more impactful than anything, not to water down the impact of what Nick and all of our colleagues do on a daily basis, but it's really the constituent outreach that makes the difference. So especially now that we have so many freshman members coming in who are looking to develop their agendas and to develop the communities that they will serve as champions for. So we're very fortunate that we have a lot of members of Congress who are longstanding champions for the Duchenne community and go to bat for us on a regular basis. But those 58 new members are really green, if you will, and are really looking for causes to champion. And so they're really important to us because as they look at all kinds of policies that will come across their desk, we want them to view them through the lens of our eyes. So the meetings that you're about to have, and whether you're going to have them here in Washington this week or you're going to be doing outreach at home and you're going to be reaching out through phone calls and emails, and then you can take the opportunity to meet with these members when they're home in their own territories, which sometimes those meetings even matter more than coming to Washington. Those will go a very long way to develop relationships that will make such a huge difference when we're talking about whether it's appropriations and report language or we're talking about MD CARE Act, PFIA, which I'll talk about in other legislative efforts. So what you're doing is so important, and we're so grateful for you taking time out to do it. So what I'm going to dive into here is the content of what we're going to be specifically talking about and asking for here in Washington this week. And there's a lot on our, I would say, overall policy agenda right now, and you'll get a lot of materials and you'll hear a lot about it over the next couple of days. But Nick, Ryan, and I spent a lot of time trying to whittle it down into a few distinct talking points so that it's not completely overwhelming, but you will be getting more information than just this. And part of the reason why there's so much right now is because our Duchenne community is changing so much. So we're identifying individuals with Duchenne and Becker at a much younger age. So our age range is pushing down, if you will, and then people are living longer with Duchenne and Becker. And so the policy issues are really changing based on the demographic of our community also. But then also because of where we are in our therapeutic pipeline, our need, our engagement, the things we're concerned about around patent protections and exclusivity for pharma and industry, all of that is changing about what we're engaging in and the priorities and policies that we're getting engaged in. So for that reason, there's so much more on our policy plate, if you will. But we have prioritized what PPMD will champion, and so I'm going to dive into that right now. So what I'm going to cover right now is the 21st Century Cures Bill. Just give you a little bit of background on that bill. Many of you are aware of what the effort has been and what the discussion draft looks like, but we'll just go through a little bit about that. And then within that discussion draft of the 21st Century Cures Bill, there are select provisions that PPMD specifically is championing right now, and so we'll go through those. One of the provisions that we were hoping would be included within the 21st Century Cures Bill was one that PPMD has authored and really been leading a push for, that is called the PFIA provision, or the Patient-Focused Impact Assessment. And that did not make it into the discussion draft, and so we are pushing for it to be included in a future discussion draft and or may introduce it as a standalone bill, and so you will be spending some time talking about that on the Hill this week. And then I'm going to go through the highlights of our report language this year, and Nick just did a really nice job of talking about why that's so important. And then I'll just kind of reiterate a little bit of what Nick talked about. Okay, so 21st Century Cures, I'm not going to spend a ton of time on this because we've been blogging about it and talking about it overall. But this was an effort that was launched in the late spring by House Energy and Commerce Chairman Fred Upton and Representative Diana DeGette. And really the purpose was to, the intent is to modernize medicine or to accelerate the pace of cures. And what they've been doing is looking at the process from discovery through development through delivery. And the way that they looked at the process is they spent several months holding congressional hearings and bringing experts from different pieces of that process, whether they're from academia, industry, patient community leaders, to Congress for congressional hearings. Pat Furlong actually testified at one of those congressional hearings. They held roundtables within congressional districts with some of those same leaders, and we had clinicians and some of the representatives from our patient community who testified at those community roundtables. There were white papers that were issued on topics of relevance to the various issues, and then there were a lot of Hill visits held on these issues. So a lot of members of these various communities who had ideas for concepts that should be included in this bill went to the Hill and met with the members who were working on this legislation. PPMD, the leadership from PPMD, spent a lot of time on the Hill over the last couple of months talking about the different issues that we were concerned about within this pipeline, the ideas we had for accelerating the pace of cures. And specifically, there was a provision that I'll talk about in a moment that we call the PFIA provision that we developed that we thought really would help target some of the issues and the gaps that we were seeing. So the discussion draft, so all of this culminated and will culminate in a bill. So the discussion draft for this bill was released at the end of January. It is close to 400 pages long, so it includes a lot of ideas. And many of the provisions are of benefit or interest to our Duchenne community. And so we've gone through those and we've really prioritized the ones that we think most closely reflect the ideas and the themes that we've heard from the community and our stakeholders, which includes not just our patient community, but also our clinicians, our researchers, industry groups we work with, that we should really be driving forward. And so there are a number of provisions that we are championing, and we've highlighted a few of them that we will be including in the language and the ask that you'll be taking to the Hill. So I pulled out a couple of them to talk about today. So one is a provision around patient-focused drug development. Now, we spent a lot of time on our specific provision, which focused on patient-focused drug development. And while our provision didn't make it into the draft, we've been told that a lot of the themes and a lot of the work we did around our provision impacted this provision that did make it into the draft. And while we're heartened by that, it's not enough to make us drop our provision. So we're going to still move forward on trying to get our provision included, but we are glad that we helped to shape this PFDD provision. So this provision is intended to strengthen the voice of the patient in the drug review process, which, as you know, we all believe strongly in, through development of additional guidance to clarify FDA processes for incorporating benefit risk and other patient experience and perspective into the review process. And hopefully a lot of the work that PPMD has done will serve as sort of a template within the agency. So another provision that we are supportive of and are really helping move forward is a provision around expanded access or compassionate use. And this provision requires drug companies to submit to the Secretary publicly available plans as to their policy to provide expanded access to patients in need. And many of you, and I'm looking at who's on this call, were involved in the development of PPMD's or the Duchenne community guidance, and specifically were a part of the imperatives group. And this was actually one of the themes that came out of that and was included in the imperatives, that we did want drug companies to disclose early what their plans for expanded access were. And so this actually very closely reflects the Duchenne community priority. Okay, another provision that we are supporting is the OPEN Act. This is actually legislation that was being led by the Every Life Foundation, which has been rolled into the discussion draft for 21st Century Cures. And this would provide an additional 6 months of market exclusivity for a drug or patent if the sponsor receives a rare disease indication. So it's, again, incentivizing drug companies to come into the rare disease space. And we're very supportive of that whenever we can be. And then this last one is, right now, it's not specific to Duchenne. It would be applicable to a lot of different disorders, but it's of great interest to our Duchenne community. So this is the genetically targeted platform or extrapolation provision, and it permits the approval of products under accelerated approval pathways using an extrapolation of data from related trials. So in the example of Duchenne, this would be if you could approve drugs that use the same backbone. So if you had an exon skip in one particular exon and there was potentially a therapy that used the same backbone, you could potentially approve other therapies utilizing that same backbone without having to do multiple trials of similar exons. This is actually a provision that was written by Sarepta and is now being discussed and supported by a number of other organizations as well. But it would have broad applicability not just to Duchenne, but in other disorders, rare diseases, and more common diseases and infectious diseases as well. Okay, so I do want to move on to PFIA. So PFIA is the provision that PPMD led. And what this does is, if you remember back to what Ryan was just talking about, there are a lot of patient-focused drug development tools that PPMD really took the lead on developing in order to be able to incentivize and facilitate the drug development process when it gets to the FDA. So we wanted the FDA reviewers to have the tools necessary to review products that come in to their division, to whether it's neurology division, whether it's going to be the device division. But we wanted them to have the framework with which to review the product that's coming into them. So what does the change that they're seeing within this trial mean in terms of the life of somebody with Duchenne? How can we better validate outcome measures? How can we translate what families are saying is important to them into real data for the reviewers at the FDA and make sure we're all speaking the same language? And so PPMD has done a lot of work in this PFDD space in order to make sure that the FDA and the reviewers at the FDA have these tools readily available. So we know that the FDA has those. What we don't yet know is whether or not when a product comes to the reviewers, whether or not those tools will be utilized at the time of the product review. And so what we're asking for is to make sure that we take this process and evolve it all the way through the product review. And so what we're asking for is the creation of a patient-focused impact assessment, which would bring transparency to the review process, and would let us know whether or not the tools are actually utilized at that time. And so at the end of the day, all it is a checklist that the product reviewers would complete at the time of a product review that would say, would the available PFDD, were the following PFDD tools utilized at the time of a product review? Yes, no, or not available. And so it would include everything from benefit risk, quantifiable benefit risk data, testimony from experts who served on the advisory panel, yes, no, not applicable, and on down the list. And that would provide an important feedback loop to the community. First, it would tell us whether or not the tools that the reviewers needed existed. If somebody were to check not applicable and we knew that the tool existed, it would mean that the tools that we had developed weren't making it to the reviewers. So what we're doing is not trying to change the way that a product is reviewed. What we're doing is trying to make sure that all of the work we're doing to create these tools and ready the reviewers are actually making it to them. So that's what we're asking for in this PFIA provision, is closing the loop, if you will. So the ask around this is to urge their House members to support including a transparency provision within 21st Century Cures, because as I said, that provision did not make it into 21st Century Cures. And then the 21st Century Cures is a House bill at this time, but there will likely be a Senate companion bill. So for the Senate to include a transparency provision within their Cures companion bill, that was the ask for the Senate, and we'll recap this in a second. Okay, so that is 21st Century Cures. All right, so report language highlights. So report language, and Nick just went through all the reasons we have report language. And so we have 4 major bullets that I'll go through for the report language and what we're asking for. I'll just read through them right now, and then I'll go through each one separately. So the report language highlights for us this year are to drive forward implementation of key provisions of the MD CARE Act amendments that were enacted into law. So again, although the bill has been passed, there's a lot of work to be done to implement it, so we're not done with it yet. To seek level funding for the Muscular Dystrophy program of the Center for Disease Control. Urging FDA to issue guidance on Duchenne therapy development, and seeking to expand a promising Duchenne newborn screening pilot in multiple states. Okay, so MD CARE implementation. We apologize because since we're doing this in webinar, some of us got a little off kilter. But essentially what this image shows you is how much work has to go into MD CARE implementation and all the different buckets. So coming out of the MD CARE Act, you know, the Muscular Dystrophy Coordinating Committee and all the work that committee does. The MD Action Plan is currently being updated by the Coordinating Committee. And that action plan really spells out a plan for how to drive the muscular dystrophy field forward related to all 9 muscular dystrophies. And then each of the agencies and all of the partners who serve on that committee take accountabilities for elements of that action plan. There are 2 new federal agencies who've been appointed to the MDCC. I think it's really important. I see some of the people on this call today are people who either have Becker or people who are adults living with Duchenne. And these 2 agencies actually reflect a lot of the issues for those segments of our community in particular. And that is the agency or the Administration for Community Living, and then and CMS, the Center for Medicare and Medicaid Services. And so we're particularly interested and seeing the services and policy issues around resources for independent living, for improving support for PCA services, for employment readiness, et cetera, to be improved within our muscular dystrophy community. And that's not something we see the Duchenne and Becker community get much attention from within those agencies. So we're hoping that changes, and we're committed to seeing that change. And on down this list, I'll do CDC separately in a second. But again, that is one of our report language asks. Okay. As related to CDC, we're looking for level funding. That's $6 million. And here's a breakdown of some of the things CDC worked on related to Duchenne. So MD StarNet is our national surveillance program on Duchenne Becker. MD StarNet surveillance began about 2001. So we're now in our 3rd phase of MD StarNet surveillance. Kathy Kennett and I have been working with MD StarNet on what new data elements will be collected in the next phase of surveillance. And that surveillance is really important in helping shape research and helping shape some of our our newborn screening programs. It's been a very important effort for epidemiology. It's the only national surveillance database we have for the muscular dystrophy. Care considerations, I believe everyone's well aware of those. Those are being updated now to reflect what's changed within our community, and it's also being pushed out to reflect, again, our adult community, acute care considerations, and then some of the sections that were not included before include a deeper dive into cardiac and bone health and endocrine health. And then again, a newborn screening program. So we feel very strongly that that newborn screening for Duchenne needs to be added to the National Newborn Screening Panel for all babies who are born in birthing centers and hospitals in the U.S. so that we can identify children and babies earlier who are eligible for treatment, and then especially for the therapies that are being developed, would be eligible for those therapies as soon as possible. And it will take a while for that to happen, so we need to get started now. Okay, and so then the last thing that was a part of our ask was for the FDA to issue guidance on Duchenne therapy development. And Ryan did a really nice job going through and describing the guidance process. So all I'll say about that is this, that the guidance was submitted to the FDA from the Duchenne community in June of 2014. The FDA published it for public comment in September for 30 days. That closed on October 6th in 2014. And then since then, the FDA has had that to work with. We do know they've had some internal meetings and that they are committed to publishing their own version of the guidance based on our guidance. But we will say they've now had it for longer than it took the Duchenne community to develop a guidance. We are heartened that they listed it on their list of FDA priorities, and that's what you're seeing here for 2015, but we are anxious to see the output from that. Okay, and newborn screening I already talked about. Okay, so Advocate Hill asked, so for the House, so here's how to just summarize everything that I just talked about, and you will get this again next week and all of your talking points that are being sent to you. In the House, it's, please sign the fiscal year 2016 Duchenne muscular dystrophy report language ask is what that should say, or appropriations request. And that is being circulated by Congresswoman Doris Matsui. And then to urge support of the transparency provision, which is PFIA, within 21st Century Cures. And then to support patient-focused drug development and related provisions in the drug review process, and support provisions to accelerate patient access and development of therapies, which is expanded access, open act, and platform technologies. And I will say these are a lot of asks. And so our recommendation is that likely within this list, there are one or two things that bubble up and really resonate for you personally. So there are things that are of great importance to you or relevant to you in your life. And so our recommendation would be, and those of you who are seasoned and have been to the Hill before know this, and have probably already done it as I've been listening or been talking, but then just take those as your talking points. And as you're in the office and meeting with the members and you're telling your story, relate whatever the talking point is that's most pertinent to you to your story. So why does platform technology really matter to you? Or why does expanded access really matter to you? Or why does this PFIA provision really matter to you in your life, and what's relevant about it? And spend time weaving that through your story. And then at the end, you'll just leave these asks. So your ask is to, sign our appropriations request and to support our inclusion of this transparency provision. Those are our two big things. But then use these other things as potential for talking points or ways to share your story or angles to come in and share your story. So that you don't feel overwhelmed by these. These are just some of the highlights of what we're working on and ways you can really frame your experience with Duchenne so that we leave a resonating message with them and an image of how these policies really impact our community, and they're just not discussion graphs. Okay, and then in the Senate, same thing. We're asking to sign our appropriations request, and that's being circulated by Senator Wicker to urge senators to support including a transparency provision within their Cures Companion Bill or FDA reform bill, and then to support the patient-focused drug development-related provisions in the drug review process and support provisions to accelerate patient access and development of therapies. And those are the provisions that I talked about. Okay, so I'm going to turn it back to Ryan.
Great. Annie, that was a really wonderful explanation of this year's agenda. Hopefully everyone has a better idea of what we're going to be asking Congress to do, and just a little bit more about why we need to continue the original momentum we started over a decade and a half ago. So I just wanted to go through some points for the at-home advocates and the advocates coming to Washington for what you can expect in the coming days. So I know many of you submitted stories for the packet drop-off, and rest assured your messages, your stories, and in some cases your pictures will be hand-delivered by our advocates to your members of Congress. In some cases, having a meeting. In other cases, it will be a drop-off, but many times a staffer will take a moment to talk to the advocates. So this has been a popular effort for the at-home advocates to send in their messages. And hopefully you're signed up for our action alerts. This is a way for us to get in touch with you while we're on the Hill, so that while we're roaming the halls, you're making calls to your representative and your senators. It really does further the impact of the message for you to make that call, and I do recommend you making the phone call and sending the email. I think if you can get on the phone with a staffer, it's very important. We're going to provide you with a call script so you're not starting from scratch in all the contact information. So expect that to happen on Monday and Tuesday. And this is Rare Disease Week, falls on our conference. So it's more important than ever that you educate these offices about Duchenne, how it impacts your family, and why they really do need to support our requests and be accountable, because you are the constituent and you keep them in office, so don't forget that. And with that said, there'll be other groups on the Hill at the same time, so let's be loud, let's be consistent, and really tell your friends to call Congress as well, and family members. Many times people say, how can I help? This is an easy way for them to help them to call their members of Congress and say, this matters to me. This impacts someone that I love, someone that means something to me. So make sure that you follow us on social media through Twitter and Facebook to receive updates. We ask that you tweet your members and follow them on Facebook. Most of them are using social media at this point, some better than others. But I think that it's another tool in our arsenal that we really can't forget about. So for those of you who are D.C. bound, we have 142 advocates registered to date, 19 states represented, and 113 meetings scheduled, and that number is rising as confirmations come. Here's a little look at the weather. We always have interesting weather in D.C., but rain, snow, sleet, hail, we're going to be on the Hill. We're going to be talking to members of Congress about why Duchenne should matter to them. So you're going to receive an advocacy binder via email. You're not expected to print that out and bring it. We will give you a copy when you get there. Soapbox Consulting is who we work with to do your meetings, and we've been working with them to schedule everything. I know some of you have sent me some conflicts and times that you're not able to attend, and that's great. If anyone else has any more of those, please email myself so I can tell Soapbox and make arrangements. There's also a really cool Soapbox app that we'll be showing you at the training that's going to have your schedule at a glance. It's going to have a way for you to snap pictures of your meetings and send them in, and also take notes from your meetings all in one place. We're going to email you talking points, which will be, actually I'm going to do a document separate from the binder, because if you bring anything that you want to read before the Advocacy Conference, I think those talking points would be really helpful. We'll have some background on how these members have supported us in the past, we create a report card basically, and you'll have plenty of group practice. Here's a look at the agenda. Again, I think many of you are aware of the times and the locations, but here's just a look at it. Sunday we'll be training. We'll go through everything from talking points to best practices for meetings. We'll distribute the schedules, and we'll do kind of mock meetings so everyone's comfortable. There is breakfast served. We'll serve dinner on Sunday night as well. Monday, there'll be breakfast served and a regulatory update. We'll do Hill meetings in the afternoon on the Senate side. And then there's an optional RDLA, that's the Every Life Foundation's advocacy arm. There's a cocktail reception. If you haven't received that information, I will be resending it to you. That is optional. There's no transportation provided, but I will send you all the details and the address so you have them. And then Tuesday is our other Hill Day. We plan on holding a congressional briefing in the afternoon. You'll receive all that information, again, on Sunday. For your actual meetings, I think this is just a helpful visual for this four-step approach to your meetings. You want to open and introduce yourself, talk about your personal story, a little bit about PPMD. Really, you're connecting to cultivate that relationship. You want to make a clear ask, and we're going to go over those asks over and over so you're comfortable with them, and then the all-important thank you, which we'll talk about again on Sunday. Making sure to stay in touch and thank these members afterwards is so important, and then keeping in touch with them over time is even more important because you develop a relationship with that office. So here are just some frequently asked questions, answers to those questions. The dress is normally business casual, but with that said, you want to wear comfortable shoes and obviously warm clothes because it's the winter and we're going to be, really on the Hill all day, going from building to building. You want to bring pictures, copies of pictures for your leave behinds. You're all guaranteed 3 meetings, but you're going to be in state delegations, so you'll have a chance to interact in other meetings as well. And you'll notice that there's so much content that what you'll want to do is rehearse with each other and take pieces of that content so you don't feel overwhelmed. One person will take the appropriations piece, another will talk about part of the 21st century cures. So you're a team in this, and no one has to go it alone. If you're a first-time advocate, don't worry. You're going to be with people who know how to do these things. So I also, before we get to the Q&A session, because I know we're over the hour, I wanted to mention that we have launched our state advocacy captain program. This is being launched today. We have a pilot in 17 states with captains in each state, and in some states there's actually 2 based on population. This announcement comes out today, and the purpose of our program for the state captains is really to have a point of contact in each state, working with families to help them create and maintain relationships with members of Congress. They're really going to be our go-to members for the Duchenne Army, if you will, helping families navigate how to advocate with members of Congress and creating relationships with these members in district and through email and social media. Many of the captains will be coming to the Advocacy Conference. You'll see in this announcement a way to connect with each captain in your state. We do not have a captain in every state yet. We plan to roll this out throughout 2015 and hope to fill all slots by the end of the year. So I just wanted to plug this program, which we are very excited about, and you'll be hearing more about over time. So with that, unless Annie or Nick has anything else to add.
Well, Rye, do you want to plug that if anybody on this call is interested in being a captain?
We'd love to hear. You're right. We should put out there that if you notice your state has not been listed with a captain yet, please contact me. I do have some folks who I've talked to already, but we will be happy to discuss the program and see if it's the right fit. We wanted to pilot this in a certain number of states first and then roll it out. So please feel free to reach out to Annie and myself regarding the program. So you see the chat box on the lower left-hand corner. You can send in your questions now or email us afterwards. I should have put my email up. It's Ryan, R-Y-A-N, at parentprojectmd.org. One question that has come in, will there be a list of those members of the House and Senate that supported the reauthorization? That's a great question. So we have report cards that will show you past support of Duchenne issues, specifically if they've signed on to a funding letter or have co-sponsored the MD Care Act in the past. This will help you in your meetings better understand past support. There'll also be a place indicated if they're a target member. There are some specific committees that are of great interest to the Duchenne community, and we indicate that on the schedule, and we'll go through that during training as well. A question came in, is there a list of states represented at the conference? We had done a post about 2 weeks back about the states that were currently represented. I should have Stephanie in our office do an update to that so everyone can see which states are actually coming to D.C. That's a good question and something that we can easily do. Another question. Are we expected to know everything word for word? No, I don't think you should put that on yourself to memorize every single piece. Your most important role is to tell your story on how Duchenne impacts you and your family. You're going to have others with you. I don't want you to feel like you have to become a policy expert. We try to make the material really drill down on the material so you can verbalize it, and you're going to be leaving behind a packet of information that has all the details. If you don't know the answer to something, that's okay. Don't panic. You'll say, well, I will be able to go back to Parent Project Muscular Dystrophy and get you the answer to that. You'll take a business card from them. And, again, we'll get you prepared for this during the conference. Annie, do you have anything to add to that?
Yeah, I would just say, I just reiterate what Ryan just said, that you're really here to share the Duchenne and Becker community story with the staff and the members and make sure they understand why the issues we bring to them matter in the context for that. And then there is a packet with leave behind materials with our asks in it. And then, you know, Nick and I are here in Washington. We're up there all the time meeting with them. Ryan and Pat frequently come to Washington with us. So if there are questions that they have, they're probably not going to get into the weeds and ask you anything specific because they're going to be really, they get so excited when constituents come to meet with them. And it's not, I'll be honest, when it's not someone from Washington coming in their office. And they're like, oh my God, you're from the district, because most of them are too. And the conversations will probably start around things happening in the district or what town they're from and what town you're from. And it'll start on a very personal, comfortable, casual level. And then at the end, if they have questions about the report languages, they have questions about it, there will be contact information for who they can contact. If there's a question that comes up, you can just say to them, you know, we'll have someone from PPMD get back to you. And then that's what we're going to spend a lot of time in the next couple of weeks doing, is circling back with people and following up. And that actually gives us great entree to go back to the office and meet with them again and follow up with them again. So it's actually a great thing if you can't answer everything, because we want to be able to go back to those offices and touch them again and follow up on issues. So
yeah,
feel no pressure to do anything other than go in and develop a relationship that then you can continue to have. I tell this story frequently that we were having a very high-level, intense meeting with a number of Senate offices last year around the MD Care Act, and it happened to be Senator Collins' office was one of the offices there, and they all looked at us and at one point just said, this is all great, and there were a whole bunch of us in the room, but how will this affect the Dunger family? Because what mattered to them were the constituents they knew at home and how this bill would, and what we were talking, the details of the bill would impact them, which was terrific because they had a relationship with the family in our Duchenne community, and what they really wanted to know is what we were talking about, was it going to help them and how was it going to impact them? And so really your goal is that when you leave, would that staffer stop a meeting and say, how is this going to impact the Smiths? How is this going to impact so-and-so? And that's what really you want to do, is leave that impression.
Absolutely. Absolutely. And regarding giving us feedback, one of the fun new features of the Soapbox app is you will be able to give us real-time feedback right after the meeting, so you don't have to think through, well, what did they say about this or that? So we'll receive that, right after your meeting if you're comfortable with using the app. And a final question I got was, do we need to make contact with the office beforehand? The answer is no. No, we have been in contact with these offices scheduling the meetings. We've given them background materials. You should be all set, and everyone will receive their schedules on Sunday. I do not see any other questions coming in. Please feel free to type them or send us an email afterwards so we can address any concerns you may have. Nick, Annie, is there anything else we want to end on, or I know we're over the hour, so go ahead.
Be confident, be optimistic, and have fun.
Awesome. And
Thank
encourage
you.
skipping in the hallways. Thank you so much, everybody. We look forward to seeing
by the Capitol Police if you skip.
We look forward to seeing many of you in D.C. And for those of you advocating from home, thank you so much. It really does make a huge impact. Thank you, everyone.
Bye.
Bye.